All right, welcome everyone. I am really excited to have Tracy Hannigan joining me today. Tracy Hannigan is a sleep coach and CBT-i specialist based in the UK. She has a BA in psychology, a master's in osteopathic medicine, and is a mindfulness-based stress reduction practitioner, certified health coach, and behavior change specialist. And she's also the founder of Tracy the Sleep Coach Online and the Sleep Recovery Course. Thanks, Tracy, for joining me today.
Thanks for the invitation. I'm really excited to be able to talk with you today.
Me too. And, we've been chatting online for some time now. And, there's a lot of synchronicity in kind of our interest in sleep and cognitive behavioral therapy for sleep. So I'm curious to hear more about why you became so interested in sleep and specifically cognitive behavioral therapy for insomnia.
Sure. Back in my previous life, I was working in community mental health in the Bay Area. And obviously in settings such as those, you see lots of mental health issues, lots of sleep issues as well. Many years later, when I moved to the UK and trained to be an osteopath again in chronic pain settings, sleep issues. And actually, no matter where you're at, if you pay attention, there are lots of sleep issues, lots of people having difficulty with their sleep for one reason or another. So from a professional point of view, became fascinated with sleep, and that's just kind of continued to this day. And my own personal interest in sleep stems from having had insomnia myself, first in my early 20s after the death of my husband, and then later on in my mid-30s. So I have some experience on the professional side and on the personal side as well. So it's just such an interesting topic that has such wide ramifications for people. And I like seeing people be really happy and living the lives they want to live, and getting good sleep can be a really big part of that for people.
Absolutely. And, I think it's really powerful as well when you're able to bring your own experiences, into, helping other people who are struggling. And, and I always say sleep is the foundation of health. And it's, really hard to function optimally and to really live to your full potential without good quality restorative sleep. So I'd love to hear more about cognitive behavioral therapy for insomnia, or CBT-i, and how it's different from sleep hygiene. Because oftentimes when I talk to people about CBT-i, so a lot of people come to me for help with sleep, and they feel like they've tried everything. They've done all the sleep hygiene things. They've cut down their caffeine. Their bedroom is cold and dark. They're trying to get enough exercise during the day, and yet they're still not sleeping. And often when I mention, maybe CBT-i or cognitive behavioral therapy for insomnia would be a good next step for you to try, they'll say, well, I've already done that. That stuff doesn't work. So what is CBT-i and how is it different from sleep hygiene?
Yeah, it is such a great question, because you're right. Everybody's heard of all the sleep hygiene tips, making sure the room is dark and cool enough, and you get good exercise and you eat well. And there's nothing inherently wrong with a lot of those things, unless they become really rigid and prescriptive. But they aren't going to solve a chronic insomnia problem. They're kind of necessary or helpful, but not sufficient. And when they've looked at research comparing CBT-i, which is gold standard kind of approach to chronic insomnia, and sleep hygiene is not a recommended intervention except part and parcel with other things. So they're often looked at as hacks and tips. And you're right, people feel like they've tried it all and end up feeling really defeated because it hasn't worked for them, in big air quotes. But it wasn't going to, right? So it's not that person's quote unquote fault that it didn't help. CBT-i actually gets to the root of the things that drive and fuel insomnia. And it's got 30 plus years of really good evidence that stands behind it, and addresses the mental and emotional side of our attitude toward not getting good sleep, and then the behaviors that we develop as a result of those fears and anxieties around sleep. So it really gets to the root of the psychological and biological things that create long-term sleeplessness out of a short-term sleeping problem.
Absolutely. And I think what's important for people to know is that sleep hygiene is one part of CBT-i, but CBT-i is so much bigger than that. And there are actually very actionable strategies from CBT-i that can help to address the root causes, as you said. And, some of the root causes that, or some of the other factors that are being addressed are the 3 Ps. So can you tell us what the 3 Ps are and what are some examples of each?
Yeah. So the 3 Ps, we start with predisposing factors, and that's the first P. And as an individual, every individual may have more or less of these predisposing factors, and they're simply the things that make you more or less likely to develop longer-term sleeping trouble as a result of shorter-term sleeping difficulty. So things like anxiety disorders, great example, perfectionistic tendencies, which I kind of lump into kind of an anxious type of person who feels like everything has to be a certain way in order for their world to be right. So those would be some really common, widely seen predisposing factors. So the second P of the 3P model is what we would call the precipitating factors, the things that happen in our life. So the stress around work, or stress around the relationships, or happy events too, weddings, lots and lots of change, whether it's good or bad change, can be a precipitating factor for having a short-term sleeping problem. What then changes the situation from a short-term sleep blip, which is a normal human response to any kind of a big stressor, what changes that situation into a self-perpetuating sleeping difficulty are these perpetuating factors. Really common perpetuating factors are found on the foundation of them is a worry about not having slept in the first place. So it's the anxiety about not sleeping. And then the things that we start doing as a result of that, which are things like trying to catch extra sleep by staying in bed, doing lots and lots of research online about all these sleep hygiene tips that we can put into place that are supposed to kind of perfect our sleep. And that is a slippery slope because that kind of that anxiety that feeds those actions and sleep efforts actually fuels the problem. Somebody feels like, well, I'm going to get a handle on this. I'm going to control my sleep by doing these things. Actually feeds the idea that not sleeping is something to be feared in the first place. And so people end up tripping down this rabbit hole. And then they wonder why they can't sleep when they're doing all the things that they think that they're supposed to be doing. It creates a lot of frustration and kind of these hopeless feelings in people.
Yeah, and you see that with people struggling with insomnia, they are trying so hard to get sleep, and that's the irony of it, is that the harder you try, the more elusive sleep becomes.
Yeah, life trains us that way. Like life says, the harder you work, the more you study, the more you know, the more you put lots of things into place to make it the way you want, the more likely you are to get what you want. And sleep is completely the opposite of this.
Yes.
And most of my clients who come to me probably have better sleep hygiene than I do.
Yeah. Yeah, that's exactly right. And this is why we have such a problem with people looking for these external sleep aids, because they're trying really hard to feel sedated and to feel tired and to get rid of that sort of hypervigilant or hyper aroused state that they're in, to kind of calm that anxiety. And so this is why I think these conversations are so important, because sleeping pills are a huge industry, at least here in the US, I know in the UK as well, and they have so many side effects. They're not meant for long-term use. And we see all, you and I are in a kind of an insomnia Facebook group, and people are constantly looking for the next supplement, the next type of CBD, the next pill, the next this and that that's going to work for them. But really the answer is kind of regulating your nervous system from within. And and you talk a lot about mindfulness, and you bring that into your approach. Could you share a little bit more about mindfulness and how that works and your experience with that?
I found mindfulness a really helpful addition to my CBT-i based practice, and I tend to use it almost exclusively instead of kind of the relaxation techniques pillar, although I do help people with some of that, because it's very tempting to look at a relaxation technique and think it's something that you can use to make yourself fall asleep. And so that then becomes a sleep effort, a safety behavior to run away from the sleeplessness problem that feeds the anxiety. Whereas mindfulness, if you practice mindfulness in a in a, for example, a daytime way. It has nothing to do with sleep. And you practice stopping and pausing and finding that space where you realize you have a choice about how you want to view and respond to things instead of react to things. You practice that in a nice, neutral way. It could be washing the dishes. It could be working in the garden. It could be playing with your kids. In a variety of different, simple, non-threatening ways. You're building muscles that allow you to perceive other things that are more important to you in life in a different way as well. And at that point, you can turn that muscle and flex that bicep around issues of sleep as well. And often as a side effect, you don't even have to really go that far into using mindfulness as a way to, quote unquote, try to help your sleep, because your mindset has already shifted so much and you're already well practiced in being able to view the situation, not necessarily from the angle you used to view it. The analogy that I'll often use with people is, kind of pre-pandemic, you go out dancing until 3 o'clock in the morning. You didn't worry about losing all that sleep. But because you're not getting that sleep now and you want it, it's not the lack of sleep that's the issue. It's the wanting to change the situation that is the issue. And mindfulness is really helpful in helping open that up and allowing people to sit with that discomfort and realize that that discomfort's not going to hurt them either. So there's the not sleeping piece, and then there's the anxiety around the not sleeping piece, and everybody's trying to fix it all at once. And being okay with not feeling fantastic is a really important part of moving forward on people's sleep journey, I believe.
Yes, that is such an important piece. And, I'm just thinking of someone who came to me recently for help with sleep, and they were actually sleeping pretty okay, but they had a lot of anxiety about, what if I'm only getting 6 hours? Am I going to develop dementia? What if I'm not going to be able to function? What if that happens and I'm going to feel worse? I'm going to feel more anxious. I'm going to develop all these health problems. And there was just so much fear around sleep or lack of sleep and what that could mean for them in terms of
it almost become a self-fulfilling prophecy.
It absolutely does.
Yeah.
And, hence, these perpetuating factors are so important to address. And I think sometimes, in the sleep world, sometimes we do people a little bit of a disservice because we do talk about the negative consequences of not getting enough sleep and why sleep is so important. But on the flip side, people who are good sleepers don't think about sleep. It just happens. It's a physiological process like digestion.
Absolutely. And the messaging around sleep, I believe, is really meant to address the issues of people who can sleep but aren't because they're doing other things. They're burning the candles at all ends. They are sleep procrastinating. They're staying up too late. But when they have the opportunity to sleep, they can sleep. But who is getting that messaging? It is the population of people who have insomnia, who are scrolling on their phone in the middle of the night looking for the next thing to fix their problem. And they're reading, oh my goodness, this is going to happen, and that's going to happen, and that's going to happen, especially around this 8-hour myth. It's really damaging in a lot of ways. And I think that although having insomnia shouldn't be an aspiration for people, it's not helpful to focus on those pieces of information if you yourself are trying to get through your sleep journey out the other side where you reconnect to your natural ability to sleep.
So true. And so, for anyone listening who is struggling with insomnia, stop reading about it. It's not helping you to do all this research. But cognitive behavioral therapy for insomnia is incredibly effective. It is considered the first line treatment by the American Academy of Sleep Medicine for treatment of insomnia before even trying medication. So, Tracy, in your experience, who does well with CBT-i? And then is there anyone who shouldn't do CBT-i, or are there any considerations with, with people who should maybe modify it? Can you speak to that a little bit?
Yeah. CBT-i is perfect for a huge chunk of people who are having difficulty long-term sleeping. If that long-term sleeping difficulty has come after an episode of change, excitement, drama, happiness, upset, and then after that component of their life experience has passed, they're still not sleeping well. It is perfect for that group of people. And that is the majority of people with insomnia. And again, it's really important to differentiate insomnia from having sleeping difficulty. And that leads into who maybe shouldn't, or who should work with one-on-one with somebody to modify CBT-i. So part of the process when you're working with a professional doing CBT-i is you get screened for essentially other sleeping disorders that need treatment first. So you could have obstructive sleep apnea, for example, and insomnia. Treating the insomnia with CBT-i not only won't improve your daytime functioning, it could actually be risky, because people who have the obstructive sleep apnea and many other sleeping disorders, they're already sleepy during the daytime, which is a real big differentiator between insomnia and the other camp of sleep disorders that are real common. They're falling asleep all day long, whereas somebody with insomnia is tired and wired and they wish they could nap. So if you're a person who is feeling those kinds of sleepy feelings, first you have to find out why by getting a different kind of assessment. So people who are feeling kind of that pathological sleepiness during the day, anybody with epilepsy, bipolar disorder, any kind of uncontrolled mental health condition or medical condition at all, where a change in sleep that is kind of sudden could create problems either for their mental or physical condition or for their physical safety, really should check with their doctor first, preferably a physician who knows what the impacts of CBT-i would be. Now, there are some people for whom some of the approaches within CBT-i need to be modified. For example, one of them is called stimulus control. And stimulus control is a great way to reassociate our psychology and our biology with our bed that is in a relationship of sleep rather than wakefulness and stress. And in an ideal world, we want to completely remove all those feelings, put them someplace else, and then bring the sleepy feelings back to the bed and essentially retrain that association. What if you can't physically get out of bed? There are modifications for doing these approaches. So if you are researching CBT-i and you go, oh, I can't do that. If you work with an individual professional who has experience in doing these modifications, they can help you get the most out of it. There are also some people who have to take caution with other parts of CBT-i, such as the sleep compression component, not reducing the amount of time that you spend in bed too rapidly or to too low a degree. So if you have any kind of physical or mental health concern, you definitely have to check with your doctor before you are trying to implement this on your own. It's not a bad idea to do that anyway, just to be safe. You might not know as a layperson that something that's going on with you could be a problem if you start trying some of these approaches.
So that's really helpful to hear about, the modifications and considerations for, with regard to sleep compression and sleep restriction. And specifically for people who have bipolar disorder or epilepsy, it's recommended not to restrict time in bed to any less than 6 hours because it can exacerbate those conditions. What about people who are taking sleeping pills? People who are taking things like Zolpidem or known as Ambien here in the US, or those classes of medications. For people who've been taking them long term, how can CBT-i fit into a plan for them? Would it even work for people taking these types of meds?
Yeah, so a really common reason people will seek out CBT-i is because they're unhappy either with how their medication is working, or they become aware of the side effects of their medication because they're personally experiencing them or they're researching about them. For some reason, they're not happy, whether it's sleep side effects or they just don't like the idea of being on something. And the good news is that CBT-i can help people in that situation taper off their medications successfully. The key thing here, there's a few things here. Unless you are working with a prescriber, your prescriber, and doing CBT-i with your prescriber, you always need to have basically a basket of support between the person who is working with you with CBT-i and the prescribing professional. Because if the person delivering CBT-i and working with you on your sleep is not your prescriber, they can't tell you what to do about your tapering of your medication. And it's really, really important with that class of medication, with many, many, many other classes of medications, that you taper in a way that is safe. And the only person that can tell you how you should go about tapering your medication is your prescribing physician working in conjunction with your CBT-i therapist. It's really important because discontinuing some of these meds really quickly can be very dangerous, unpleasant at best, dangerous at worst. So, and there are some therapists who say you shouldn't be on medication if you're doing CBT-i. And there isn't really a hard and fast rule about that. It's really down to the therapist. For myself and many of the people that I know that work with people with insomnia, the general rule of thumb is on, off, or tapering under supervision. The tapering under supervision piece has to be under the supervision of the prescriber, although the therapist can help with the psychological part of tapering, which is usually the biggest part. The anxiety about, how much am I going to cut up? Which leads to the one big thing that is a problem for CBT-i, and that is contingent medication use. If you sometimes use something and you sometimes don't, or you're on your taper and you're cutting up your medication and you're thinking, tonight I might need a little extra. This is constantly reinforcing to your psyche and your biology that sleep is an external thing, and it makes it really difficult if your aim is to taper off medication to use contingently. And it kind of butts heads with the point of CBT-i, which is to kind of lean yourself back into being in touch with your natural ability to sleep. Because that natural ability is inside and you don't lose it. But if you are believing that sleep is like in this little thing,
yeah,
it doesn't matter what's in that little thing. That belief will get in the way.
Yes.
And yeah, I mean, it seems to work in the short term, and that's because it temporarily reduces our arousal and anxiety about sleep because we give the power over to something outside of us. Often we've lost faith in our ability to sleep if we've not slept well for years. Your arousal becomes lower, and voila, you sleep. But it really isn't because of that external thing. So that's where the issue of medication and CBT-i kind of can either work really well together or can be problematic.
Yeah, and again, to anyone who's listening or watching, there is hope. Both Tracy and I have worked with so many people who have successfully, in my case, I help people wean off medication, and they'll often work in conjunction with a CBT-i specialist to do that, and it works. It can be done. And Tracy, you yourself are living proof of that. You've overcome issues with insomnia in the past. And so there is hope for people. And, sometimes with these types of medications, the benzodiazepines and hypnotics, it's important to taper very, very slowly. And I go very slowly and conservatively with tapers, even sort of longer than what guidelines might recommend, because it is so important to address that psychological piece, that externalization, where people feel, well, I can't sleep without that pill or without that.
That can be a long process sometimes.
Yes. Yeah, but it can be done.
Yeah.
So what are some elements of CBT-i that anyone listening could start to implement if they're struggling with insomnia?
So I would say one of the first things to bear in mind, and this is great for anybody who's listening who doesn't have sleeping trouble, because you can use this knowledge moving forward when you have a sleep blip, is to not chase sleep. So if you're having difficulty sleeping and you're tossing and turning and having some broken sleep because of something that's going on, be aware of your tendency to want to go to bed early or to lay in bed late and try to catch up on your sleep. If you imagine, the analogy I like to use, if you've ever rolled out your own pizza dough and you have a blob of pizza dough and you put it under a roller and you're trying to stretch it out, if you've got about a 6-hour blob of pizza dough or a 6.5-hour blob of pizza dough and you're trying to stretch it out to 8 hours, what happens? It's a really good analogy. It gets thin around the edges, becomes harder to fall asleep. You might wake up early, it starts getting holes in the middle of it. You start having broken sleep. And it's thin and it's not able to support all of the stuff that you want to put on top of it. So probably the first thing I would say is don't chase sleep by spending extra time in bed. So if you're awake, get up and start your day, and start your day at the same time of day if you can, and push through, wait until you're sleepy, and then go to sleep. The second thing that I would put into this is particularly for those who are obsessed with how much sleep they're getting. And my number one tip I give people is to try not to look at the clock. Knowing that you've been awake for 47 minutes starting at 3:12 a.m. doesn't do anything for your sleep except give you a place to hang your sleep anxiety. It doesn't give you any information that you can then use to help improve your sleep. And quite the contrary, you can actually start training yourself to wake up in the middle of the night because you have this arousal response to, oh my goodness, it's 3 o'clock in the morning. And what a bad night to have a bad night of sleep because I've got an interview in the morning. There's a big alarm, a big arousal around that. And your body and mind say, ooh, we better check this out the next time we come around that particular time of night. We're checking for safety. And she believes something really unsafe happened. And you can then look at your clock again and wow, it's 3 o'clock again. And you can train yourself to wake up. So number one tip, aside from not chasing sleep, is to stop watching the clocks.
Mm-hmm.
And question the beliefs that you have around the consequences of sleep. Because we tend to put our feet on the ground after a rough night and predict that we're going to have a bad day. And it becomes a self-fulfilling prophecy. You know, people are worried about messing up at work or having an argument with your spouse. But if you stop and take a look at it, you've probably had an argument with your spouse after a good night of sleep as well. And you might have messed up at work after a good night of sleep as well. And they've done numerous studies where people are making these predictions about their performance after not sleeping well. And they think on a scale of 1 to 10, I'm going to perform a 3 because of my sleep last night. And they actually almost always perform better than they think that they do. So being mindful of how you think about sleep and feed the anxiety around not sleeping inadvertently. Again, I like mindfulness for that bit of kind of stepping back and creating space where you can then look at things just a little bit differently. Question these automatic assumptions and automatic beliefs.
Wonderful. Yeah. And this also ties into that 8-hour myth that you were talking about before. The myth that you have to get 8 hours of sleep every single night. And that's just not how sleep works. Some nights you get a little bit more, sometimes you get a little bit less. There's a flow to it. It's kind of like hunger. Some days you're just more hungry, sometimes you're less hungry, and that's okay. That's just part of your normal physiological flow.
Yeah.
And so the more you can kind of flow with it, the easier sleep becomes.
Absolutely. I keep a pendulum here as a prop with clients, right? So life and sleep, it kind of ebbs and flows and moves around. If you try to make it a certain way, you've got a big problem then, right? and it's fueled by looking at it from a very kind of narrow viewpoint rather than sitting on top of that pendulum and just letting things move. Even people who don't have sleeping difficulty aren't really good at estimating exactly how much they sleep. Right. And sleep is not the same from night after night after night. So wanting sleep to be exactly the way it was before, it was never the same before either. So it's kind of a hiding to nothing to be wanting that kind of consistency.
And what about for any physicians or therapists or other healthcare practitioners that might be listening in and seeing patients in their clinics who are struggling with sleep? Are there any tips from CBT-i that you would suggest that they could try that wouldn't take a lot of time for them in clinic?
Yeah, emphasizing not chasing sleep, and you could take that a step further by emphasizing waking up at a set time in the morning, getting morning light first thing, eating first thing, and not going to bed until you're sleepy. And that's different from being tired. And in the context of somebody who is probably chasing sleep by going to bed early and waking up at irregular times to catch a little bit of extra sleep, it's going to have the effect of compressing sleep and improving sleep quality. So that can give people a little bit of confidence in their ability to sleep because they're going to get sleepy. They're going to feel, ooh, things are working. This is helpful. And they'll perform better during the day. They'll feel better during the day because their sleep will be of a deeper quality if they do that consistently. So I think that would be an important message to deliver. The other one would be if you're having a lot of anxiety in bed, don't stay there. Get up and do something that you enjoy doing. A lot of people are worried that if I get up and do something I enjoy doing, I'm then going to be awake all night. In the short term, that's not a problem. It actually will increase somebody's drive for sleep, which can, if you're using it in combination with that other technique, can help improve people's sleep. So explaining sleep drive in that context is important. You don't have to go and sit and read a calculus book in the dark. You also probably don't want to do a Zumba workout. There's an in-between ground to finding something that you like. It's not going to be overly stimulating. When you get sleepy, again, that's a good thing for people who are worried about not feeling sleepy. They can then take that sleepy feeling back to the bed with them.
Wonderful. So where can somebody find a CBT-i specialist, whether it's online or one-on-one or in a group?
Yeah, so there is a CBTI.directory where there are a lot of CBT-i trained specialists from a variety of disciplines who are registered with the Society for Behavioral Sleep Medicine. There isn't one overarching national for the US or international organization. So aside from a list like that, inquiring with sleep psychologists who have probably trained in CBT-i, or a psychologist who says that they specialize in sleep, inquiring what that means to see if they are trained in CBT-i, because sometimes it's not always made obvious on people's websites. Knowing where the resources are, because family doctors, GPs here in the UK don't often have the time within their consultations to be able to deliver even kind of a brief version of CBT-i across a bunch of sessions. So having a network of people who are trained would be a really handy thing to do, and having that available to be able to easily give to a patient who's in for consult would be really helpful.
Perfect. Yeah. And so the Society of Behavioral Sleep Medicine is a great place for people to start, as you said. And then there's also all these apps out there like CBT-i Coach, Somrist, Sleepio. Any suggestions or thoughts on those?
There are apps coming out every single day. So here in the UK, you can either pay for there's a particular app, or if you get a referral from your GP, you have access to it for free. So Sleepio is one. I know that the VA in the US also has resources online for being able to self-deliver CBT-i. And there are a lot of people who are working online one-to-one as well. So if you know you are in a population of people who might have a slightly non-standard type of situation, having the ability to work with somebody to adapt the techniques and approaches so that they're successful for you really does need a little bit more one-to-one work, because it's impossible to cater to every single possible need in even the most sophisticated app. And sometimes people just need that little bit of extra personal support as well. There are lots and lots of resources between things you can read, courses that you can take, CBT-i networks that you can find online. There are a lot of resources for people. So as much as the internet can create difficulties for people who have insomnia, who are trying to research all the things, it also is a fantastic way to get connected with people who know how to help you using the evidence-based approaches.
Wonderful. Yeah. And I know you have an online course and other offerings. So could you tell us more about that?
Yeah, I run a 6-week online course called the Sleep Recovery Course. It is essentially a version of CBT-i that you can do yourself, and you go along through the modules at the same time you are learning modules around mindfulness. So there's a built-in mindfulness program within that 6 weeks, so that you get really the mindfulness side that I think is so helpful, the cognitive side and exposure to using and practicing different cognitive tools that are the part of the cognitive component of cognitive behavioral therapy. And you get introduced to the concepts of learning how to use a sleep diary for yourself, to look at your sleep a little bit more objectively, and how do you use that information then to help you improve your sleep. And there's some self-help tips around troubleshooting things like, what do I do in the middle of the night if I choose to be the person who gets up? So it's fairly comprehensive and covers all the pillars of CBT-i plus the mindfulness piece. I also do one-to-one work with clients, and we'll be hopefully launching a group coaching in the summer this year as well.
Where can people find you?
TracyTheSleepCoach.co.uk and on Instagram at TracyTheSleepCoach. I also have a brand new, not quite as awesome as yours YouTube channel, Nishi. Doesn't have a fancy name yet, but if you put Tracy the Sleep Coach into the YouTube search bar, I will come up. I'm always taking questions so that I can do new videos and provide new content for that channel as well.
Well, that's exciting. Congratulations on all of that. Yeah, and it's been great to kind of follow you and see your growth and how you're really, helping so many people who are struggling with sleep, as we said, is, a foundation of health. So do you have any last words of wisdom for our viewers?
I would say the most important thing to take away from anybody talking about CBT-i is that CBT-i is meant to be used in its whole as much as possible. It becomes really tempting to look at some of the practical tools of CBT-i and look at them as a way to control sleep. We can't control sleep. All we can do is orient our biology so that sleep can do what it does. And we can use these cognitive tools to get out of our own way so that our arousal system can tune itself down and let sleep and our circadian systems do what they do best. So if you're interested in CBT-i, look at it really, truly as a very holistic approach. Even though it's very practical, there's not a lot of kind of fluffiness about it. It's something that you can implement, but it is not something where you do one little piece of it and then you decide it doesn't work. Because CBT-i, even if you can't do the behavioral pieces because of some medical condition or health condition, really using the cognitive tools and a mindfulness approach, a way of looking at your sleep a little bit differently, that can be enough. And you can get back to being reconnected to your sleep ability.
Well, thank you. This was a great, glimpse into CBT-i and how it can work for people and how it intersects with mindfulness and helping people taper off medication as well. So thank you for, this conversation, for
Thank you so much. It's so wonderful to be able to talk to you in person.
Oh, you too, Tracy. I'm so glad that you were able to make the time, and I really appreciate, everything that you shared today. So can you share your website again?
It is TracyTheSleepCoach.co.uk. And from there, you can find all of the other links and videos and things where you can get more information about CBT-i and some of the work that I do.
Thank you so much. So we'll share the link on the screen here, and then we'll have it in the video description as well.
Thank you.
Thanks, Tracy.